Thanks for joining us, the Understanding Drainage and Detoxification webinar featuring Nestmann Pharma Remedies. My name's Heather Schofield, and I'm a classically trained homeopath with experience for the last 20 years using complex homeopathic remedies and drainage and detoxification. I'm really excited to be sharing the Nessman Remedies and drainage and detoxification and all the theory that goes with that and being able to present it through this webinar. In addition, I'm super excited to have all kinds of voices from practitioners across Canada who have shared their wisdom and their expertise and clinical tips and pearls using the different Nestman remedies, which are throughout the presentation that we will soon see. Okay, so with all that said, let's get started. Okay, so first and foremost, we need to talk about toxic chemicals. If there was no toxic chemicals, then we would not have to be assisting our bodies with additional drainage and detox remedies. Our bodies are set up to be able to clean up the mess. And if we're exposed to toxins and chemicals and bacteria and viruses and all kinds of different things, our bodies are designed to be able to handle the load. It's when the load becomes too heavy that problems start to occur, and this is when we as practitioners need to step in with the different drainage and detox remedies to support the body to get back into regulation. And so when we're talking about drainage and detoxification, that's exactly what we're talking about. The body has potentially got an overburden, and we are stepping in to be able to help release that overburden so that the body can get back into self-regulation. There is over 80,000 toxins and chemicals on the U.S. market today. And so, yes, we're, in Canada, but one of the things to understand is that we do share airspace and we share agriculture and we share a lot of things, including personal care products. And so that number of toxins can also be a good reflection of what we're exposed to in Canada as well. Exposure increases burden on the body. It can enter the body through absorption, being swallowed, or inhaled. And the emunctories, or our detox organs, they're constantly working. Our liver and our kidneys, they never take a break. They're always filtering and filtering, 24 hours a day. And then our bowels are another major evacuation route. So with toxins then, exposure truly is unavoidable at this time. And so our best defense really is detox. And one of the reasons we need to care about this is because toxins do pose an increased risk and development of potential disease. One of the things that we're starting to see is that neurodegenerative disease is on the rise, and there is very solid links between heavy metals, including mercury and lead and aluminum, to name a few, that can be associated with some of this neurological and neurodegenerative decline. And so being able to be tooled up to help ourselves and our friends and our family and our patients be able to decrease the toxic load in the body will also help to protect the body from going down some of those roads and being able to stay in a healthier space. Increased toxic load also decreases vitality and can make one appear older. So it's not anti-aging, it's an aging thing. 104 environmental pollutants are found in every single person in the USA. So studies were done by the Center of Disease Control. And then the Environmental Working Group has amazing resources on their website. And they were looking at newborn umbilical cord blood, and we're finding on average there was 287 different industrial compounds and pollutants that were detectable. And so that's pretty scary. These newborns haven't even been in the world or the external world at that point, and there's already that much toxic exposure that they're having through their mother. And so, once again, it's really important that we continue to work on supporting our own personal bodies by doing solid detoxification. And detoxification isn't just about getting rid of toxins, but it's also optimizing our detox organs as well, which we'll go into in a little bit. So looking at Canada's chemical industry, There is close to 3,000 different chemical or industrial companies, and this includes industrial chemicals, like basic ones like crude oil, synthetic resins and fibers, agriculture chemicals, so fertilizers and pesticides, pharmaceuticals and medication, and then other types of formulated products like paints, adhesives, sealants, soaps, and toiletry preparations, and then a whole other list of other. And so you can see that there's a breakdown in the Canadian representation of the chemical industries that are producing things in our country. And then in the U.S., as I mentioned before, there's over 80,000 chemicals on the market. Many of them are used daily. Many of them are known and or suspected carcinogens, and most of them are understudied and underregulated. So it's really important to be aware of this without getting overwhelmed, choosing when we can organic foods and natural cleaning products and natural health products, and also natural health care products and skin products that we're putting on our bodies. The more natural we can go, the less exposure that we would have on a daily basis with some of these types of chemicals. Oh, yes, Dr. Lewis, you're right. It is terrible. It's a high number. As I said, we got to really protect ourselves. Okay, so then when we're talking about drainage, then what does this actually mean and how does it work? So the Nestmann Pharma Remedies are classified as drainage and detoxification remedies. There's also, of course, many other complex herbal and or homeopathic remedies that are also in this category as well. They're designed to drain, to repair, and to regenerate. And so this is the part that's also really important to understand. When we're talking about drainage remedies or detox remedies, we're not talking about just getting rid of toxins or promoting an organ like the liver to dump bile in order to release toxins, but these drainage remedies also have a biochemical effect on that specific organ or tissues or organ system, and so it allows that system or that specific organ to do some repair, and in many cases even start to regenerate. And so there's a lot going on when you're using drainage and detoxification that's really helping support the body get back into a healthy space. So one of the big things it helps to do is it helps to jumpstart the detoxification process, and that's by having a biochemical effect to stimulate or facilitate the elimination of waste products. And then this follows homotoxicology principles, which we'll talk about in a moment. And then it helps to improve metabolic function of the organ. And one of the ways is by increasing circulation and blood flow to that organ. And therefore, it helps to support that organ then to release cellular waste from the connective tissue and surrounding cells. And then it allows it's clearing the pathways essentially for the connective tissues also to clear. And then finally, it supports constitutional weakness. And so wherever each of us as individuals have our constitutionally weak areas also tends to be where the toxins will settle and get stored within the body, which then creates a change in the environment within the body. It can change pH. It can change the microbial flora and fauna that are in that area. Toxins, especially metals, attract viruses, and so you can get heavier viral loads and bacterial loads and more tendency to infection and inflammation. So all kinds of stuff happens when those toxins settle. So by able to target those organs or that specific tissue by using one of these remedies, you increase circulation to that area, will then allow that area to be able to start to better detox. So therefore, it helps to improve that constitutionally weak area in the body as well. And so the Nestmann Pharma Remedies, they're designed very specifically to stimulate organ function within about 20 minutes after that they're taken. And having that biochemical effect and increasing circulation to the organ is the two main functions of what the Nestmann Remedies are doing as drainage and detox remedies. Okay, so then let's just briefly talk about homotoxicology according to Dr. Reckeweg. So this is this idea about toxicity and kind of how it's functioning within the body. And there's this really wonderful 6-phase chart that shows through these different stages and kind of moving towards degeneration and the biological divide where the progress could go. And then through drainage and detoxification, you're helping to reverse that process as well. I didn't put that chart within this presentation. However, if you're interested in a copy of the chart, let me know and I can email you a copy as well. Or if you do a Google search, the homotoxicology 6-phase chart, you should be able to find it if you don't already have a copy. And so you've got the organism plus endogenous and exogenous toxins, and this gets into the blood. Now, the blood should be going through the liver and through the kidneys to get filtered. And if this process is working well with these detox organs, then you will be able to, the body will still stay in good self-regulation, and the detox organs will be moving the toxins out of the system. However, over time, the toxic load can start to become a burden, and so the blood then will deposit these residual toxins in the connective tissue. Once toxins are starting to get deposited into the connective tissue, this is where issues will start. So as I mentioned about the constitutionally weak area, the toxins tend to migrate to that area where there's a constitutional weakness. So, for example, if constitutional weakness is a new concept for you, you may find in the family that arthritis runs in the family, or lung issues run in the family. And so those can be inherited constitutionally weak spots in the body through the family line. And so then your constitutional weak spot might be your lungs, and so every time you catch a cold, then it tends to go to your lungs. Or every time it gets rainy or the pressure systems change, your joints ache. And so it's this idea, or digestion's another really big one, where you eat something and all of a sudden diarrhea or inflammation is occurring. So this idea, though, the toxins can accumulate in these areas. It affects the cells. It starts to change on the DNA level, and then you end up kind of getting these inherited toxins and newly acquired toxins really integrated within your system. And then this pattern repeats. And so what we really want to do is optimize our detox organs in order to be able to keep our system as clean as possible, even if we've gone down this route, because you can still clean things up. And by cleaning things up, then you're going to have less tendency towards having different things happening symptom-wise in the body. Okay. So with that brief overview of drainage and detoxification, let's talk about Nestmann, since they're known as the drainage people in Europe. And so Nestmann Pharma has been around for over 6 generations. It's 6 generations of naturopathic doctors and pharmacists. And they're located in Germany. And so traditionally what was happening is the great-great-grandfather, Nessman, was seeing patients, and according to iridology and what he was seeing in the eye and constitution, was determining what specific herbs a patient would need. Then that prescription would go to the pharmacist, and the pharmacist would compound that for the patient. And then the patient would take home the complex remedy, whether it was a complex herbal remedy or it may have been a complex low-potency homeopathic remedy. What the pharmacists were noticing over time is that the same formulas and the same recommendations were happening over and over again. And so they started actually producing it into larger volume. And those are the remedies that we know today. And so Nessman is known as the drainage people, but they're also known as medicine of experience because the formulas that exist today have been around for the 6 generations and based on clinical experience. There's lots of really great things about Nessman as a company. They are family-owned. They are small-run. They grow all of their herbs in medicinal growing fields. And everything is harvested according to these medicinal herbal principles. The remedies are all still made by hand, if you can believe that one. I've seen it with my own eyes, and I've been very luckily with a colleague to Nessman, and we were able to spend 3 days there and really get a good tour and an understanding of Nessman as a whole, and seeing the remedies also made by hand as well. And then they also are having everything standardized and everything is pharmaceutical grade, and so that standardization is really important so that you're getting the required medicinal ingredients within each bottle as well. And so that is a little bit about Nestmann Pharma and their remedies. And so they're really well known for their quality, their outstanding quality, and the effectiveness. Quality is important, but also working is also important as well. And as I mentioned before, the criteria for remedies, drainage remedy, is it must increase circulation to a specific organ, area, or organ system, and it must have a biochemical effect as well. And when you have that combination of things, then you're actually able to support the different organs in the body and get the, essentially, since we're talking about drainage and detox, getting the toxins out and optimizing the function of that organ as well. Okay, and then finally, just as a last super cool point about Nessman, the remedies are really cost effective and they really do achieve that targeted elimination. I also wanted to take a moment to mention about low potency complex homeopathic remedies. And so Nessman contains two categories. There's either herbal formulas or there's low potency complex homeopathic remedies, anywhere from a D1 up to about a D8. And in that dilution, just as an understanding, so a D1 is 1 drop of the mother tincture, the herbal tincture, to 9 drops of water or alcohol, and then it's succuss to hold the potency. If you're making a D2, then you take 1 drop of that and you put it into 9 more drops of water or alcohol, and then you succuss or bang that as well to hold the potency. And so the idea when you're doing that is you're slowly diluting up. However, when you're still dealing with something in a D8 format or potency, you're still dealing with physical substance. So there's a very physical, active ingredient that's happening. And so a lot of the time when one's talking about low potency homeopathic remedies or complex homeopathic remedies, in a lot of ways, it's easier to think about it like a herbal formula because it's acting in the body more like a herbal formula than it would in a traditional higher potency complex or higher potency homeopathic formula. And so because you still have that physical material in there, in many ways, it's just a lot more gentle on the body. So with the remedies then, you're using that to increase circulation, increase metabolic function, and then therefore help eliminate toxins within the body. So that's kind of it all in a nutshell. There's some pretty nice advantages to using low potency complex homeopathics. They're readily available. There's no intense practitioner training often to use the products. So as we start talking about the products, you'll see that, they're fairly straightforward to use. The low potency effects are very evident in a very short period of time. And so you don't have to wait around for a long period of time to see if a remedy is going to work or not. Generally, there's very few complications. There's few side effects. More than one remedy can be taken in combination. And because in a complex remedy there's many substances, generally you have kind of better overall health or better health benefit for that actual patient. Because if there's 5 things in there and the patient really needs 3 of them, they're going to be in there and it's going to be able to do what it needs to do for the patient. A few things that you could classify as disadvantages, the deeper rooted issues like psychological disorders are not as effectively treated with low potency homeopathic remedies. Sometimes if there's prolonged treatment, you might run into patient compliance issues. Sometimes if you've got really sensitive patients, the full remedy of all the combination may not be compatible with them, or they might prove the remedy, which generally doesn't happen with the low potencies. More it's about sensitivity. And then finally, patients who are not able to use alcohol-based remedies may not want to take the remedies as well. Most complex homeopathic remedies and complex herbal remedies are in an alcohol-based tincture. And so one of the solutions is using the daily dose and putting it in water or allowing it to dissipate overnight. So there's definitely ways to deal with the alcohol and to get the alcohol out of the actual remedy. And so generally the benefits definitely or the advantages outweigh the disadvantages in most cases. Okay, so then let's talk about the emunctories. The emunctories are different organs in the body that are meant to drain or remove toxins or materials from the body. And so we've got two categories. We've got the categories of the primary emunctories and the secondary emunctories. And so the primary emunctories are the main detox organs that are doing the main heavy lifting for detoxification. In addition, most of the primary emunctories also have some route directly out of the body. The secondary emunctories may or may not have a direct route out of the body, and they also were involved in detoxification, but they're not the main organs doing the detoxification. And also in many instances, the secondary emunctories drain into the primary emunctories. And so one of the things when we talk about drainage or drainage and detoxification is there is a really important thought process into going, what do you do first? What do you open up first? What do you target first? Because if you start targeting certain organs, let's say like the lymphatic system, and start doing lymphatic drainage, but you don't have a good direct route out of the body, then what can happen is you can get detox reactions, or you can get patients flaring, and then that can be fairly discouraging for everybody. So I just put a little note at the bottom of this slide here to talk about what to open first. In addition, I wanted to mention Dr. Melina Roberts, who's done many webinars for us in the past, and so they're recorded and available in our webinar archive. She also has a wonderful drainage and detox talk that she's done, and in there she also explains in lots of detail about what essentially to open first. So first, you've got your primary organs of detox, which are kind of like the pipes, the main pipes out. Sometimes I think about those all like a toilet. And so these are the pipes out to the street or to the sewer. You've got your secondary organs, which is a funnel into the pipes. And so you need to make sure that the pipes are open and clear and moving before you start funneling more in. So if you've got a clogged toilet, and you can't flush that toilet, it won't flush. You can't keep adding more and more things into it, or else it will overflow. And so you've got to make sure that those pipes and the drains are all open and flowing first. And then once you've moved past the secondary organs into the tertiary organs, which tend to be more about the extracellular, intracellular spaces and the connective tissue, so not organ per se, but more about tissues, all of that will drain into the funnel, which will drain into the main pipes. But you've got to make sure the main pipes are open first to allow everything else to happen. And once you've got those pipes open, then the secondary organs are going to naturally be able to start funneling things in. And then the extracellular and intracellular spaces are also going to have a better opportunity to start draining as well when the other bigger kind of load is out. Okay, so to just do a quick overview for detoxification and elimination. So we've got toxins that are entering through usually the lungs, the skin, or the GI tract, or through the mouth into the GI tract. All of this gets absorbed into the blood, which then gets filtered by the liver. Now the liver, if it's doing a good job and it's not overburdened, will be able to create water-soluble toxins that can exit through the skin, through the kidneys, through the colon, or through the lungs. However, if the liver is overburdened or not functioning optimally, those toxins will become excess toxins, and then those toxins will deposit into the tissues. And where it gets stored will depend if it's a fat-soluble toxin or if it's a water-soluble toxin. So if it's a fat-soluble toxin, it tends to go more towards the fat cells, the bone marrow, the liver, and the central nervous system and the brain. If it's a water-soluble toxin, then it tends to be going more towards the joints, the blood, the tissue, or the muscles. And then once you start getting an accumulation of toxins in these different tissues, then this is when you can see all kinds of different symptoms starting to show up, or signs of toxicity, things like rashes and allergies and pain in the joints, autoimmune, cardiovascular, chronic fatigue, constipation, diabetes, diarrhea, fibromyalgia, headaches, hormone imbalances, inflammation, IBS, neurological disorders, weight gain, and they can all be things that are associated with increased toxic load in the body. And so then to start being able to target with the Nestmann remedies to open up the detoxification, we've got a chart here that's indicating your primary emunctories and what your primary emunctory remedies are, and then your secondary emunctories and what those remedies are to support that as well. Now, you don't have to be an expert on the liver and to know if there's liver detoxification or not. I've got slides to talk about that. And if somebody needs, because they have a lot of sinus congestion, to help to reduce those symptoms, then absolutely you could use something like Hydrastis nasal spray, even if the liver hasn't been addressed. And so there's definitely, a lot of room for being able to just move in with the remedies as necessary, but also understanding that the liver and the kidneys and the intestine are going to be the big areas that you want to make sure are moving well and have been supported so that everything else is going to detox much easier. Okay, so let's then start to talk about some of the different Nessman remedies. And the one thing I just wanted to let you know is that in the different slides, there's a lot of information. And so I'm going to just go and do an overview of the different remedies and highlight the main points. The presentation has the information in it so that you can use it as a reference. In addition, we have the Nessman Compendium. That's a downloadable PDF that has information on each of the Nessman remedies. We also just created a brand new Nessman remedy booklet that has an overview of the remedies and some quick reference charts. And so we've got lots of different resources available. We have other Nessman remedies in our archive that you can also listen to that include more detail on each of the remedies. And then, of course, I'm always available to talk further about it as well. Okay, so with that, let's start going through the remedies. Okay, so indications of liver detoxification. When does one need to do liver detox? So generally, you tend to see a lot of abdominal and digestive type symptoms, including things like bloating, pain or discomfort over the liver area, abdominal fat, trouble digesting fatty foods, acid reflux, heartburn, indigestion, bad breath, overheating of the body or perspiration. On the skin, you can see acne or rosacea or liver spots. There can be weight gain issues, cravings, blood sugar issues, fluid retention, congestion, chemical sensitivity, or somebody being a lightweight when it comes to drinking alcohol. Multiple chemical sensitivity is part of that. And then fatigue, that's not relieved by more sleep, and insomnia with early morning waking. We can't forget that also the liver functions at processing emotional toxicity. And so sometimes the emotional toxicity will show up as an indicator that the liver does need a good detox. And so things like anger and irritability and resentment and frustration and complaining can all be part of a liver emotional picture, or needing to be able to process some of that emotional toxicity. All right, so the last detox thing that I want to, actually I guess it's the third last, is just to look at the liver detoxification for phase 1, phase 2 detoxification as a reminder of what's happening within the liver. So the liver is presented with the different toxins, and it's going through phase 1 detoxification and turning these toxins into intermediate metabolites. There's a lot of vitamins and minerals and nutrients that are required to support the liver to do this. And then these reactions that are occurring actually make these intermediate metabolites more toxic often than the original toxins. And so it's important to be able to support the liver for optimal liver detoxification so that it can easily move through phase 1 and phase 2 detoxification. If the intermediate metabolites get stopped, then the reactive oxygen species and tissue damage and free radicals all can ensue. So antioxidants are also really important for the liver to support liver detoxification as well. Then once the liver moves those intermediate metabolites through to phase 2 detoxification, then generally it's a water-soluble byproduct that is ready to be excreted. And so it will be excreted from the liver to the gallbladder through the bile, which then the bile is excreted into the intestines and then evacuated through the bowels, or it goes into the serum, which gets filtered through the kidneys, and then urine is created and so evacuated through the urine. And what we want to do is make sure that we are not only supporting the liver so that it can go through that phase 1, phase 2 detoxification process well, but that we're also supporting the other detox organs to get these now toxins or water-soluble toxins or less toxic toxins excreted out of the actual body. So to do so, we have got the liver gallbladder remedies, and the lineup is A. hepatica, Cardis, and Cardinera. And so what I've done is I've highlighted in here when you would use the different remedies. So A. hepatica, generally, it's a liver and gallbladder detox with the focus on the liver. It's for chronic liver conditions. It definitely helps if somebody's had a lot of exposure to chemicals. It helps to stimulate bile flow. It definitely increases detox of the liver and helps to support secretions in the digestive system. Cardis, it's also a liver gallbladder remedy. However, it's gallbladder first, liver second. And so it's used for people that are not secreting bile very well. And one of the reasons you would know that is if they're having difficult fat digestion or floating stool, or they're having a lot of congestion or gallstones. In addition, if somebody's had their gallbladder removed, Cardis is still a very relevant remedy because the bile ducts are still there as well. So Cardis is for the gallbladder and constipation typically. A. hepatica is more for the liver and no constipation. And then we have Cardinera, which is a third remedy. It's derived from artichoke, and it's going to have a liver gallbladder picture, liver more than gallbladder, lots of congestion, and there's going to be some sort of fat component, so high cholesterol, high triglycerides. The doctor wants to put somebody on a statin and they don't want to go on it. This can be used as a natural alternative, and so there's lots of digestive issues like indigestion and fullness and belching, and then Cardinera also is really helping to get that bile flowing, improves fat digestion, improves blood flow to the liver, and then it is working at helping to decrease cholesterol and triglyceride blood values. So Cardinera by itself actually works really nicely to help lower cholesterol and get the cholesterol and triglyceride and total cholesterol picture in a much healthier space. Of course, I'd say diet's really important, and then we also need to think about stress as well. Okay, so here we've got our first testimonial and clinical pearl from Dr. Melina Roberts. And just before I read it, I see that a question has popped through. So Dr. Wallace, you can definitely use Cardis if there are large gallstones. You can also use Cardis if they're small gallstones. Cardis doesn't typically promote stones moving. It really just gets the bile thinner so it can start moving better. And so Cardis is really used to get the bile moving. If there's a lot of kind of sluggish bile and or there's a lot of constipation, or just in general there are gallbladder symptoms that are there. And so it can be used. There's not a contraindication if there's gallstones any size. It's going to help with gallbladder sludge. It's going to help to move the small stones. And then there are other techniques that can be used in biological medicine to help deal with some of the larger stones and getting the body to start naturally breaking some of those down by changing pH and environment and different things as well. Okay, and so since we're talking about Curtis, Dr. Melina Roberts, she sent some of her experience in. So she is a really big Nestman user and really loves, as she says, I love the Nestman products. And so one of her favorites is Curtis. She says that she treats a number of her patients with digestive issues and finds Curtis is extremely helpful for these patients with constipation. Since Curtis helps to support proper bile flow, it plays an important role in improving bowel movements. And so Dr. Roberts is using it not only for bile flow, but also keeping the bowels moving, and then also helping in situations of constipation as looking at the gallbladder or insufficient bile flow as one of the potential reasons why the constipation is in play. Okay, and so then because we've got a few more questions that have come through here, so now one of the things to understand, and so Erin brings up a really good point, is that some of the dosing that you may see on some of the remedies there's a sliding scale, and this is generally with like drainage and detox remedies in general. And so Nestmann Pharma has all of their dosing according to experience. Our labels, because of how regulations are, may be a little bit different than that. And so I would definitely say follow what's on the label. If you want to go off-label and use what is more traditionally the European dosing, then absolutely you can do that as well. You're still going to get good results. And also just to understand, too, that with these specific remedies, it does say to take 20 drops or 35 drops or 30, depending on the remedy, 20 minutes before a meal, and it's mixed with a little bit of warm water, 2 to 3 times a day. A lot of the time, I recommend when you're doing liver or gallbladder detoxing to take it with a meal that's substantial. So if somebody's just drinking a cup of coffee in the morning, that might not be the best time to detox. It's nice to get some food behind when the liver and the gallbladder are secreting bile, so that you have the bulk behind to actually help excrete it out. And so my common practice is to recommend the remedies before the 2 big meals of the day, or meals that contain a lot of protein or a lot of fat and or a lot of heavy fiber bulk to help with the whole detox process. And so, so you can take it twice a day, you can take it 3 times a day, you can take 20 drops. Some of the dosing has it a bit higher as well. So, just to understand there is some flexibility with that. So, okay, and Faith. Yes, Curtis is one of the remedies you can take if a mother is nursing. Most of the drainage and detox remedies you don't want to ever be doing while somebody is pregnant and or nursing, because you don't want to be getting more toxicity being flowing kind of within the body, and so that the infant then, if they're nursing, would be getting that toxic load. However, Curtis is only promoting getting bile moving, and it's excreting or evacuating out of the bowels. And so in a situation of the detox remedies, Curtis is one that fundamentally would be okay in a nursing mother. I still often would always recommend not to be using this stuff within the first 3 months of a newborn as well, just to wait till they're a little bit older. Okay. So I think I already kind of mentioned about cholesterol. And so cholesterol is not just a straightforward situation. It's lots of things. The cascade, you've got some sort of stress or autonomic nervous system dysfunction. Acid-base balance ensues, and there's inflammation. And inflammation also can affect the blood vessels, and so then the blood pressure increases. And when the blood pressure increases, then you can get micro tears inside the blood vessels, and so then the body thinks, oh, we need to get some of our glue, and so cholesterol starts to form. And also cholesterol is a really cheap and easy molecule for the body to manufacture. And if somebody's under stress with a lot of cortisol needs to be able to kind of bound onto something, so cholesterol tends to be the molecule that it goes on. So as you can hear, like, there's so much that's involved in this. But when you start to step back, stress is part of the problem. When somebody's got high cholesterol, stress is part of the problem, and inflammation is part of the problem as well. So being able to not only use something like Cardinera to help support the liver and to reduce the cholesterol, but also using vitamin C to start reducing inflammation inside the vessels, and then using something to help with the stress. Avena sativa, which we'll be talking about later, is a really great remedy within the Nessman line to do that, or alternatively, you can use some sort of adrenal support as well. All right, so for kidneys, Dr. Andreas Marx is my original mentor for Nestmann Remedies. He is a German naturopath, and for a long, long time was the owner and educator for Marco Pharma in the U.S. And so one thing I remember from early on is that Dr. Marx was talking about the kidneys regenerating. And I said to him, but Dr. Marx, the kidneys don't regenerate because that's often what we're taught in school. And he said, actually, the kidneys do regenerate. They're slow regenerating organs, but if you give them time and you give them the right support, then you can get some regeneration that's happening with them. And so Buco is the remedy to be able to do that. So with kidney support and drainage and detox, it's recommended to go for at least 3 months in general protocols to really give a good time to support the kidneys. So indicators for kidney detoxification, you tend to see fluid retention or edema, swollen or puffy ankles and feet and the face, changes in the urine. Urine is more difficult. There's blood. There's less or more, lighter or darker, foamy or bubbly, urgency, and waking in the night. Now, there's a lot of kind of things going on there, and what I would definitely recommend is if you've got patients coming to you with blood in their urine, or the color has changed, or it's foamy or bubbly, or there's difficulty in urination, that these are things that need to be further investigated through medical doctors, and then sometimes it's a bit of an urgent situation. So please don't just think that the drainage and detox remedies are going to be the only thing. Other things need to be investigated. However, some of the Nessman remedies can be pretty helpful as well. Other things for kidney detox, nausea or vomiting, feeling sluggish, pain in the back of the legs or the lower back, bad taste in your mouth, itchy rashes, and anemia can all be associated with the kidneys. The emotional side of things, kidneys are associated with fear and shame and criticism and failure and lack of strength. And so fear is the big emotion that goes with the kidneys as well. And then as kind of just a general quick review with the kidneys, so you have blood flow that's entering the kidneys through the renal corpuscle, and then it kind of goes through its whole process where things are getting reabsorbed, like water and ions and nutrients. You end up having water being reabsorbed. You have different solutes and filtrates all running through as well, and like sodium and chlorine ions, and then toxins and acid and drugs can all be secreted through, and then it gets collected into the urine, and then it goes out via the bladder. And so there's a lot of absorption and reabsorption and excretion and secretion that's happening kind of within the whole kidney in order for urine to be made. And so we want to be able to make sure that we support this entire network when we're working with drainage remedies. And so we've got two different drainage remedies for the kidneys. We've got Solidago and we've got Buco. Solidago is a universal drainage remedy used for all kinds of kidney type conditions, and then Buco tends to be for when things are a little bit more of a chronic problem or a long-standing problem, and or there's kidney stones, and or you want to start working on kidney type regeneration. So Solidago can have a very acute effect. It's in our Nessman Detox kit, so it's typically used kind of just for our general kidney type things, but also for UTIs and cystitis and different types of infections. It also works to get urine excretion happening as well. And then bucco tends to bring a lot more circulation to the kidney tissue. It is working with the adrenals a little bit. It's helping prevent kidney stones, anti-inflammatory, and so it's definitely one that's a little bit more of a long-term kidney formula, and for when things, the kidney needs a lot more support for kidney function. Okay, and then from one of our practitioners in Edmonton, Henrietta, she sent in some information regarding using Solidago. So she finds that Solidago in her practice works extremely well for any kidney or bladder infections. It is a good drainage combination with Lymphodrop and Hepatica, as we have in our detox kit. Often she uses it as drainage with parasite infections in children, and that helps to stop bedwetting at night, and it can be used as a diuretic. Okay, and I'm going to just take a peek here. I see there's a whole bunch of questions, so let me answer them while we're in the midst of still talking about some of these things. So Cardinera, so for Tina, yes, when you're working with Cardinera and you're working with cholesterol and reducing triglycerides and getting that picture looking better, I 100% agree that a better nutritional diet is really important. Cardinera is not a miracle remedy if somebody's still going to eat a less than optimal diet with too much protein and too much fat and too many processed foods, and so nutrition is super important. But as I mentioned with cholesterol, also dealing with stress and dealing with inflammation in the body, and diet can also be a big factor in creating inflammation. So there's a lot of different things that have to be addressed. However, if you've got patients or clients that are willing to make some lifestyle changes, make some diet changes, have some of that stress addressed, then the ability to reduce cholesterol and get it back into a healthy range is very possible. I've seen it lots of times, but being able to just take a remedy and decrease it on its own, it's not necessarily going to work. Mind you, with all that said, I have seen it work with people not choosing to make changes in their diet as well, but then it becomes a bit more of a Band-Aid effect. So yeah, okay. And as far as fatty liver goes, Hepatica, yeah, would be a really good option, and I think out of all of those would be a really good option. Sometimes with the remedies you can switch them up a little bit. So Monica, like if you're getting great results with Hepatica, I would stick with that. You could consider adding Cardinera in. What I would consider more, though, is if the patient is tolerant of krill oil, I would get the patient either on tocopherol or biotrienols. The biotrienol, or the natural vitamin E, the tocotrienol, has some really great clinical results of actually reducing non-alcoholic fatty liver. And so having that as part of the whole liver drainage and detox component could turn good results into really great results. Okay, and so Renee, as far as fluid retention, that's a good question. Fluid retention could be, how do you know if it's caused by the liver or the lymphatic system? So fluid retention typically is more of a kidney issue. It also can be a cardiovascular issue, or kind of things aren't like for the vascular or the venous system is not as efficient, and so what happens with the lymph? It's good kind of moving into that. So if the lymph is not running optimally, and the lymph is a passive system. And it depends on movement, like muscle movement in the body, or it depends on the venous system getting the blood back to the heart. And so if one of those systems isn't working great, then it may be hard for the fluid in the lymph system to get back up from the bottom of the body. In addition, if the capillaries are leaky, then you can get a lot of fluid draining out, and then the lymph system has to take over and try to clean it back up. And then this can all be connected in with the kidneys. So it's, as far as fluid retention goes, it tends to be more associated either with the kidneys or the lymphatic system. With the liver, you tend to get more congestion that's happening, but the congestion isn't always seen as fluid retention in the same sense. So I hope that gives you a bit more information there. Okay, sorry, I've got a couple more questions here. And so if somebody has a hyperfunctioning gallbladder, you could still consider Cardis, because Cardis is a general gallbladder remedy. It is going to, if the gallbladder is being finicky, it can also get that sorted out as well. There could be other underlying issues. The gallbladder tends to have a fairly high microbial burden that lives inside of it, and so that would be working on some more train medicine and acid-base imbalance, and doing a little bit more of a in-depth detox protocol with additional gallbladder and or liver support as well. Okay, Sarah asks how long for treatment. Typically anywhere between 2 and 3 months for most of the remedies, and because that takes about how long for the body tissues to regenerate or turn over, and the body the cells with the different organs, they can range. It can be days to weeks to months, and depending on what the organ is. And so a 2 to 3 month duration is fairly typical. And most of the remedies are designed to last for 3 weeks or to a month with each bottle. Dr. Lewis, which one's for gout? We're getting to gout, so I'm going to leave you in suspense for a little bit, but I'll make sure that I emphasize it when we get there. And then Sarah, with Cardinera, so if somebody's getting their blood taken so they can see what their initial result is, then you're going to want to be on Cardinera for about 3 months. You can start to see changes within a month, but typically it takes up to 3 months. And that if somebody's also sticking with the lifestyle and diet changes, then within that 3 month period you can get some really great results. And I've seen it happen many times as well. So, okay, great. Keep the questions coming. And let's talk about the lymphatic system. So the lymph system, as I was talking about, is a passive system, and these two remedies, Lymphodrop and LAPA, are very classical formulas for detoxification of the lymph, the blood, the extracellular matrix, and the connective tissue. And so we want to remember, like, we're first really concentrating on the liver, and we're concentrating on the kidneys and the bowels and the lungs, in many ways, and then the lymphatic system is kind of the next system that we're working on, and then that extracellular and intracellular matrix and the connective tissue is that third layer. But often if you get those first two systems cleaning out, then the extracellular and intracellular matrix and the connective tissue can start to drain on its own. Okay, so then indication for lymphatic detoxification. So, Renee, this might explain things a little bit more for you as well. So when do you need a good lymphatic detox? A stagnant lymph system is a toxic accumulation indication. And so if you're seeing a lot of swelling, then you could be also surmising that maybe the lymphatic system is stagnant and there is some toxic accumulation happening as well. The types of things you'll see if somebody needs some lymph support is edema, fluid retention, cellulitis, inflammation and pain, swollen glands, congestion, lymphedema, sinus, ear, and throat infections. Sometimes a stagnant lymphatic system can be the root cause for chronic sinusitis. Weakened or impaired immune system. The lymphatic system and the immune system are fairly intertwined, especially with the spleen being one of the kingpins in there. And then finally, multiple chemical sensitivity. Here's a kind of a little list of things. So the lymphatic system usually is fairly congested. The liver gallbladder is not detoxing chemicals out of the body well. Chlorella is a great binder to put in using digestive enzymes to make sure things are getting broken down and absorbed properly. Methylcobalamin, so B12, and methylfolate to help support the liver as well. All of those things can be pretty helpful for people that are multiple chemical sensitive. Okay, so the negative emotional state with the lymph system or lymphatic congestion, loss of track of the essentials of life, warning for need of balance, inability or unwilling to forgive, and not necessarily perceiving or receiving joy from the mother. And as a side, an interesting fact, every person has anywhere between 501 and 700 lymph nodes in the body. That's a lot of lymph nodes, and so it's a lot of nodes to keep healthy and happy as well. Okay, so generally then, this is a good overview of lymphatic drainage and detox, and so the lymphatic system kind of collects whatever has been deposited or leaked out of the capillary system, and then it requires this passive system to get back up into the venous system and back up into the heart. And there's these little flap-like kind of flagellae and valves that are all in there to help the fluid kind of move up in the body. So the lymphatic remedies, we've got Lymphodrop and LAPA. So Lymphodrop is the typical one you think about for lymphatic support and drainage. It gets lymph moving. It helps to reduce that capillary permeability to protein so you don't get the leaky capillaries. It generally improves general circulation. It helps to eliminate waste and toxic load, especially where it's accumulated in the tissues. And then for any sort of lymphatic congestion or edema, sports injuries with swelling, pediatrics. This is a really good pediatric or child remedy, and allergies and urticaria and itching can also be associated with it. And then LAPA is also a lymphatic remedy, but it's a little bit different. It's not kind of a traditional lymph remedy. Instead, it's more blood cleansing and stimulating the lymph. And so you're getting kind of this whole scenario of getting the blood cleaned and purified. You're doing broad spectrum detoxification. It's stimulating the lymph system. It's increasing elimination out of the body. And whenever there are any sort of metabolic wastes that are showing up from detoxification, LAPA is really important to put in because it helps to get that metabolic waste cleansed through the blood and excreted. And so if you've got patients that are really sensitive or there's healing reactions or after hormonal or candida cleanses, there's kind of reactions, LAPA is usually the remedy to get in there to get things cleaned up. And it also is a really good extracellular matrix or connective tissue drainage remedy as well. So LAPA is not necessarily considered as a first remedy. Work on the bigger organs first and then bring that in as a secondary remedy. Okay. And so then to bring it all together, we've got the Nessman Detox Kit. And so it's got Ahepatica, Solidago, and Lymphodrop in there. And it covers off kind of your major detox organs and just getting a really good jump start on detoxification. So if you're not really sure where to start, this is a really great place to start. Patients typically should take 2 kits. One's going to work, but if somebody's never detoxed before, 2 is great. If somebody is into a detox, an annual detox routine, doing 1 kit in the spring and 1 kit in the fall is a really great way to support the body through keeping it open and regulated. Okay. So we're going to move into heavy metal detox remedies in just a moment. I see there's another couple of questions that have popped in. So Chantal, the PDF of this presentation, I'm going to email it out tomorrow, and there is within the chat a link for downloading the presentation as well. Okay, and then Lillian, for clearing the lymph nodes in the neck and the collarbone area. So depending if it's kind of simple, you've eaten something and your body doesn't like it, then, in addition to kind of cleaning up the gut, doing some lymphatic massage and using Lymphodrop can really help. Sometimes if it's some of the cases we've talked about that's a little bit more in detail, then that kind of goes beyond this presentation today, and so it may not be as simple as using a lymphatic remedy. But if the lymph nodes are swollen and it's not due to a serious health concern, then the diet may be where things need to be looked at, or the intestinal tract, because that often, if you've got foods that are a problem causing inflammation and you've got the Peyer's patches, which is part of the lymphatic system, that could be flaring everything else up. It may be that there's just something in the diet that's triggering and creating kind of imbalance overall. So it could be a bigger and more convoluted question, and I'm definitely happy to talk to you on the phone about it. Okay, so as far as fluid under the eyes, puffy, it tends to be more kidney, but it also could be allergies as well. And so looking at doing some kidney drainage, looking at allergies, looking at the gut and try to work on that, and then maybe doing the lymphatic afterwards. But the kidney would be the first place to target. Kidney or allergies are the first two places to look at. In addition to that, you could use Lymphodrop plus Solidago. So you've got your kidney remedy and you've got your lymphatic remedy. That could be pretty helpful in a situation like that. And you're probably looking at anywhere between 1 and 3 months to try to help. Okay, so then for heavy metal detox, I just wanted to, because it's a pretty big topic, I just want to do a quick overview of it. And so chlorella and Solantrix are the two remedies that we've got. Chlorella is a blue-green algae, and it's classified as a binder. And then Solantrix is cilantro that has been heated to above 70 degrees, and so it's a mobilizer. And chlorella you could take at any point, any time, in the sense that it's a remedy that's a standalone remedy. It's great when you're doing any sort of detoxing because as a binder, it will help to move things out of the body. Solantrix should always be combined with a binder because it's a mobilizer. If you start moving toxins, and Solantrix is well known for moving heavy metals, you need to have a binder within that to be able to bind it on to get the metals out. And if you don't, then the body could end up just moving metals around. And so typically they work in tandem, or at least when you're using Solantrix, you need to use chlorella as well. But chlorella can be used on its own in many situations. And so anytime you need a binder, you want to do some detoxing. If somebody's eating tuna, then those are some times to use chlorella. So chlorella is a binder of heavy metals, chemicals, and pesticides. It's used for heavy metal detoxification. Mercury is one of the big ones it's used for, and it will help to get stuff out of the non-neurological structures in the body. And then Solantrix is cilantro that mobilizes heavy metals. It's also used in heavy metal detoxification, and it has an affinity with mercury, aluminum, lead, and tin. It helps to mobilize metals and toxins within the tissues of the body, including the neurological structures, so the nervous system, the brain, and the spinal cord. And so if you're moving stuff from those systems, you then want chlorella in the body as well, so it can bind on and evacuate it out of the bowels. And so then Dr. Isabella Leung, who is a naturopath in the Toronto area, she sent her testimonial regarding chlorella and Solantrix, using them as a pair for heavy metal detoxification. And she says, I have used Solantrix and chlorella for mercury detoxification. Patients achieved 20 to 50% reduction in serum mercury levels in 3 months, which is very impressive. They love the taste of chlorella and think it resembles the taste of sushi. It definitely has a nutty flavor to it. So thank you, Dr. Leung, for sharing that experience with us. Okay, and so we've got a brand new heavy metal detox protocol. The protocol is not brand new, but how it's been laid out is brand new. And I will be super excited to have the new heavy metal detox protocol in a brochure or in a flyer available for you. And we're going to be putting it together in a bundle. So for those of you that want to be working more with heavy metal detoxification, then the remedies will be bundled up with this really excellent chart to talk about the real solid way to do it. When you're working with metals, there's definitely things that need to be taken into consideration, and you definitely need to think about opening up those emunctories. So the liver, the lymph, the kidney, the colon all need to be moving well before you start moving metals, or else you can get some pretty interesting and very unpleasant detox reactions as well. Chlorella typically is safe. You don't necessarily have to open everything up to use it, but once you start Solantrix, you really want to make sure that you've already done your pre-phase 1, the prepping to open up the detox pathways. And then there's some additional things that can be used and recommended. Typically, you're looking at probably about 6 months of detoxing. It takes some time, 3 months, 6 months, 9 months, depending on the patient and what the load is like. And you tend to do it fairly slowly, so it's not like a really hard push either when you're working with the active detoxification. All right. So, yes, Dr. Lawrence, you definitely will get this presentation from me tomorrow, and the heavy metal detox chart, yes, it will be included as a attachment to the email. Okay, so I see there's one other question here regarding Candida and mercury. So Candida and mercury, Candida in the body naturally tends to bind onto mercury, and so if your mercury levels are up within your body, typically there's going to be some sort of dysbiosis, or Candida levels are also going to be up and out of balance. And so if you're starting to do some Candida detoxing, then what can happen is the Candida, as it's being downregulated or dying off, depending on the method you're using, you can get a lot of mercury release. And if you don't have a binder in the system, in the body, while that's happening, then you can get a lot of detox reactions or HERC reactions. And so the relationship is that they have an affinity to each other. So typically when you're doing a mercury detox or targeting that, you want to also be looking at doing some downregulation of Candida to support that. And if you're doing a Candida detox or work on that, you need to have at least chlorella as a binder in the mix to be able to bind onto the mercury that's being released to be able to minimize reactions. So there's a relationship for that. Okay, and okay, so then we've still got a little bit more to get covered here. So I'm going to start moving through this because I realize it's also getting late for lots of people. So, I do also, so Maureen Fontaine has mentioned children rubbing Lymphodrop along the jawline can be very helpful rather than using it as an ointment. And Dr. Lawrence, I'll have to get back to you regarding 8-month-old with rosacea since birth. Most likely there's some digestive stuff or maybe needing some lymphatic support as well. Okay. And yes, everybody, I'll make sure that I get the presentation for you and also the slides and the heavy metal detox chart in proper protocol and all kinds of protocols for you as well. Okay, so for the immune remedies, we've got Allernest for allergies. And basically it works like a natural antihistamine and reduces any sort of allergic reaction within about 20 minutes. It's good for seasonal, environmental, and food allergies, and helps to take care of all the symptoms that are associated with it. And so Dr. Andrea Horniak is a naturopath in Ontario, and so her clinical pearl, I've used Allernest for many years with my patients with food allergies to help decrease eczema, itching, in addition to seasonal allergies for children and adults. It works amazing. So thank you for that clinical pearl into your wisdom. And then Maureen talks about using Allernest and Hydrastis nasal spray for allergies and sinusitis. And so patients with seasonal allergies and chronic sinusitis obtain quick and lasting relief with Allernest and Hydrastis. Often they have tried everything and nothing has worked, like the combination of these two remedies. So not only is Maureen using the technique of reducing the histamine reaction, but she's also working at reducing the inflammation in the sinuses as well with this combo. And patients will notice a difference very quickly with both of these remedies because they act very quickly. And in some ways, they can be a little bit more for symptomatic relief in addition to the drainage remedies as well. Okay, and let's see here. So, and Dr. Lawrence, so with the mom with rosacea, okay, so that requires a bigger conversation. I'd love to be able to talk to you on the phone with that one, and then we can add the 5-month-old with eczema. Lymphodrop, you absolutely could. I don't know about Allernest. The gut is probably where to get going in there as well, but Lymphodrop can be very helpful, potentially, and safe in a 5-month-old. So, okay, so for Bronca and BioBoost. Bronca is a herbal complex formula that's used to calm the cough reflex, and it's a bronchial dilator, so it gets more airflow into the lungs and out of the lungs, and then it also increases more blood flow to the actual lungs. And so it's really great for coughs and kind of loosening things up and decreasing inflammation. BioBoost, it is a homeopathic remedy that's used to increase the natural defenses for viral and bacterial infections. It's known for colds and flu support prophylactically, and also for if somebody's experiencing symptoms as well. It's kind of our best emergency remedy and very well known for that, for colds and flus, and lymphatic kind of inflammation. So Judy from Whitby has submitted a testimonial and on BioBoost. The Nestmann formula that I love the most is BioBoost. It's very effective in enhancing my immune system while fighting flu and cold symptoms. My clients also find it effective for flu season. And it is a great remedy to have in stock with upcoming flu season. It's not quite upcoming yet, so that you can send it home with their patients, and then you know that they have it, so if they start to feel flu-like symptoms, then they can immediately start using it because they have it at home already. Okay, and so with Bronca, Henrietta from Edmonton also gave a clinical pearl for Bronca. Bronca is very good for any lung conditions involving a cough. Also works with chronic cough in case of allergies and is useful in asthma as well. Combined with Pleosan clubs will resolve bronchitis and pneumonia. And also good to combine with BioBoost, so Bronca plus BioBoost for chronic chest infections. So as you can see, by combining some of the remedies, you can actually get some pretty amazing results with some fairly serious conditions. I'm not saying to only be using Bronca when there's some serious respiratory issues, but Henrietta also is a really long-term and long-time practitioner with huge amounts of experience, and so having her share her wisdom is showing the depth of how these remedies really can work. Okay. So for sinusitis and rhinitis, Hydrastis nasal spray, it's sprayed straight up into the sinuses and the nasal passages, and it reduces inflammation. It's antimicrobial. It gets secretions happening better in the sinuses. And for anybody experiencing sinus conditions, it really helps with that. Loofah is a really traditional loofah sponge remedy that helps to decrease inflammation in the sinuses and helps stimulate secretion as well, so can be used as a technique to help reduce symptoms of sinusitis. Corrine from Cape Breton loves Hydrastis, and so she sent her experience with, I started to use Hydrastis nasal spray and find it to be the best product for supporting my respiratory health. Helps keep my nasal passages nice and healthy, which keeps me breathing clearly. I just love this product and will continue to use it for myself and clients. All right. So we're going to continue to move here with the GI remedies. Just before, I see a question. Hydrastis nasal spray into a nebulizer. That's a good question. And I don't know because there's alcohol in it. So if you were inhaling it straight into the sinuses and nasal passages, yes. Into the lungs, I would have to double check whether that's actually safe or not. So I'm not sure. Maybe is the answer. So I can get back to you on that one. Okay, GI remedies. So let's switch into there. So absinthium is an amazing stomach remedy. It's a bitter herb. It's a daily digestive. It works amazing for heartburn, acid reflux, and increasing hydrochloric acid production in the stomach. So as far as a drainage remedy, it helps to increase hydrochloric acid production in the stomach. It helps to normalize it. And it's really effective in cases of acid reflux and heartburn and indigestion. It also, because it's a bitter, it helps to kind of normalize as far as microbial components go as well, and H. pylori. And so there's a whole host of things absinthium is really great for. And then with rubus, it is our pancreatic support and maintenance, and it also can be used in type 2 diabetes. So basically, it's stimulating the islet system in the pancreas for the hormones for insulin and glucagon. It helps increase pancreatic secretions, the enzymes in those hormones, and it helps to lower blood sugar by regulating blood sugar metabolism. And so it is a really nice drainage remedy and to bring more support to the pancreas in cases of type 2 diabetes or in cases where the pancreas isn't secreting as many enzymes as it could. And the one thing also to remember is the pancreas is actually fairly susceptible to pesticides and agricultural chemicals that can have a big effect on it. So doing some pancreatic support every once in a while is also a really great idea. And then we've got a heartburn protocol here for you using absinthium and the acid-base balance remedies, and I'll make sure to follow up with that information in a bit more detail for you in the follow-up email. And we've got a couple of cardiovascular remedies here. So we've got Lapa showing up again. As I mentioned, it's a blood cleanser in addition to a lymphatic remedy. And then Aeschylus is a circulation and venous support remedy. So it helps to improve peripheral circulation. It strengthens the vein walls. And to know kind of or to be indicated when to use this, you would see venous congestion, peripheral edema, and varicose veins and hemorrhoids, and poor circulation to the extremities. So varicose veins and hemorrhoids are the big indicators that this remedy could be useful. Now, for Dr. Tanya Winchester in Nanaimo, BC, she sent in her testimonial on Aeschylus, and I like the title, Drive Nutrients to Targeted Tissues. So Dr. Winchester says, my favorite Nessman product is Aeschylus. It is often one of the first remedies I use with patients. We often discover on the Reba device that circulation is out of balance. And in my mind, as a practitioner, this means that the most fundamental component of healing is blocked, the ability to get nutrients to targeted tissues. So I use Aeschylus as a driver delivering nutrients, improving function, and improving the self-healing capacity of the body. It's also really great for Raynaud's, cold limbs, and any kind of peripheral diabetic issues. All right. So, Carly, as far as Aeschylus in pregnancy, I'm going to have to look into that one. I believe the answer is probably yes because it's not really moving toxins. However, I would have to just do a double check. All of the remedies will indicate whether it's caution, warning, or contraindication in pregnancy and breastfeeding. So I can definitely get back to you on that. For Aeschylus and varicose veins, so typically you can start to see results anywhere between 1 and 3 months. And this is the feedback often I've gotten with this remedy as well. I also, Judy is just mentioning about expiry dates. So, of course, the Nessman remedies have expiry dates on them. Sometimes there's the opinion homeopathics never expire, or they expire 10 years past the manufacture date. So it's an individual choice. I wouldn't recommend if you've got expired product to ever sell it to patients, but if you want to use it for personal use, if it's not too past expiry, then you can always consider doing that. But that's not my official stance is stick with the expiry date or let's talk on the phone. Okay, so organ support remedies. So there's just a few more here to cover off. And so we've got adrenum, which is for adrenal support. The one thing to take away with adrenum is that exhaustion, fatigue, adrenal burnout, but it does not. It's not an adaptogen, and it is not stimulating the adrenal glands. Instead, it's a regenerator, and it's very regenerative. So for people who have a lot of exhaustion and are having a hard time after stress or adrenal burnout and exhaustion, adrenum's a really nice remedy to get in there to help support the recovery with the adrenals. Polygonum is a joint remedy, so it helps increase circulation to the joints. And so, Dr. Lewis, this is where gout hangs out, is with polygonum. It helps to increase the excretion of uric acid and increases circulation to the joints and the tissues and the capillaries. So gout falls into that category, including inflammation of the joints and arthritis and rheumatism. And then we've got Sabal cerulatum, which is for the prostate. It's a homeopathic. It's known as the homeopathic catheter, so it opens things up. So it increases circulation to the prostate gland. It enhances libido, and it's generally known as a remedy used for libido and enlarged prostate or prostatitis. Typically, you want to combine it with Solidago and usually an alkalizer remedy as well. Okay. And so from Henrietta, we've got one more testimonial regarding polygonum. Polygonum works well in any inflammatory process. Use this on a regular basis in cases of osteoarthritis, rheumatoid arthritis, and gout. No issues with long-term use. Relieves pain fairly quickly. I use anywhere from 15 to 30 drops 2 times a day. Excellent product. All right, so these clinical pearls and testimonials, it's so wonderful having them throughout this presentation. Okay, so then Lycopus is a thyroid formula, and it increases circulation to the thyroid gland, helps to regulate thyroid function. And the one thing that's super cool about Lycopus is that you can customize the dose depending on the patient. And so it's used for thyroid dysfunction in general, both a hyper and a hypo picture. And so with the hyperthyroid picture, you use a lower dose of 5 to 8 drops 3 times a day. With the hypothyroid picture, you use 15 to 20 drops 3 times a day, so the higher dosing. And if you want to customize the dose, then you can also do that by setting a certain dose, and then you increase 1 drop by 1 drop until you get a tachycardia-like sensation, and then you back it off, and then you know that that's the actual customized dose. And I'll make sure in the follow-up email that I send some information on how to do that. Okay, and so let's talk about female tonic. And I see that a question has popped up regarding female tonic. So if somebody's trying to conceive or get pregnant, using female tonic and adrenum would absolutely be safe. Just the one thing to always remember whenever you're thinking about female tonic and pregnancy is that trying to get the hormones balanced in order to conceive would be safe. However, female tonic is not meant for during pregnancy. Female tonic is also not meant for breastfeeding moms because you don't want to start changing hormones around when their body is already doing things that it needs to do to be able to breastfeed. So female tonic before conceiving, yes, but not during pregnancy and not during breastfeeding. And Chantel, adding nattokinase to that mix, yes, that would work as well. And so I would think about at least 3 months to start and see where things go with the patient as well. Okay, so, and there may, Chantel, we could talk about that further because there's a few other things to take into consideration as far as acid-base balance for both male and female, and there's a few other things as well. But that would be a good initial place to start. So hormone balancing is where female tonic is at. It's for hormonal support. It helps to regulate the sex hormones in the body for women. It's an overall tonic for menstrual health from kind of menstrual, premenstrual to menopause. Like it works that whole spectrum. And it increases circulation to the female organs, so the uterus and the ovaries. It helps stimulate the liver. It calms the nervous system. It has some additional adrenal remedies within it. and can be used with anything that's kind of in the hormonal sphere to help to do some rebalancing. This remedy, female tonic, can be taken as a long-term remedy. I know personally I have patients, and then I have got lots of practitioners with their experience with their patients, and the patients just feel better when they're on this remedy because it does a really nice balance for them. And then, so what we've done is we've put it together as a hormone balance bundle. So you've got female tonic in there to be working on balancing the actual hormones. And then you've got Cardis for the gallbladder and the liver for bile to be able to excrete out excess estrogen and excess hormones to help process that. And then you've got the LAPA in there on the weekends to kind of clean up the metabolic waste from the excess hormones. So this combination works really nice as a hormone balance for women. And so Erin was so kind to send in her testimonial regarding the hormone balance bundle. And so she's an acupuncturist, and she says, I have a lot of female patients on the hormone balance bundle, which is very true. My patients get amazing results. Bye-bye hot flashes, and hello, better sleep and better moods. And so that combination of remedies and with what Erin is talking about with her experience with patients is really what we hear over and over again with working to balance the hormones and, you know, really put the liver gallbladder into that mix and making sure that the metabolic waste is getting cleared out of the system. Okay, and then this is the last one, I promise. And so we've got the nervous system remedy here. This is called the Vena sativa, and it basically works on calming the central nervous system down. It works on the parasympathetic and sympathetic nervous system, calms the nerve conduction, and it allows people to just manage stress much better. So nervousness, restlessness, hyperactivity, insomnia, depression, it kind of works in all of those realms. It also can be used as a sleep aid. And then Dr. Felicia Fu sent in her experience with Vena sativa. And what she says, she's based in Vancouver and is a traditional Chinese medicine doctor and acupuncturist. And so she mentioned patients who have been recommended Vena sativa have an amazing positive result with sleep disorders, PMS, constipation, diarrhea, IBS, allergy symptoms like itchy nose, throat, headache, depression, mental health issues. According to the symptoms, respiratory issues, or sleeping disorders, I often combine with Hydrastis nasal spray and melatonin spray, respectively. And the dosing that she likes is a higher dose at 30 drops 2 to 3 times per day for 3 days a week, and then followed by 20 drops 3 times a day for an adjustment period. And then the maintenance dose is 10 drops 1 to 3 times a day as needed. All right. So then we visited this slide already, so it's just kind of a recap of the different Nestmann remedies and where they function in all the different organs of detoxification. And I want to bring it all together now. There's 2, 3 more things. Okay, so to bring kind of the remedies and talking about the remedies, Maureen Fontaine, who's in Victoria and is a master herbalist and dark field microscopist, amongst many other things, she had sent in her clinical experience with methodically restoring health. And so what she means by that, and I think this is a really nice way to just bring everything together and show how all the remedies can really work synergistically, individually, but then also together in protocols and in their timing. So what Maureen shared, my method of approach with opening up the emunctories using Nessman products. As I work with releasing congestion, stagnation, or dampness in the patient's body, I begin with the Nessman Detox Kit, using blood as the indicator, and she does this through dark field. This may be repeated 2 to 3 times accordingly, followed by LAPA and Buco to support the process of elimination, even more metabolic waste. The result is the visible mediation of the Pissenger space or plasma and notable elevation in oxygen uptake. Both live and dry blood evidence the liberation and reconciliation of the encumbered cells and tissues. Health is methodically restored. So thank you, Maureen, for sending this lovely testimonial in and allowing me to use it to wrap kind of everything up in just how lovely things can be used in timing to get to the results that you're looking for with your patients. Okay, and so thanks for sticking with this webinar and this virtual dinner training. We've got some resources for you. We've got a Nessman compendium. We've got lots of different handouts available for yourself and your patients. We've got protocols, including the new heavy metal detox protocol that's been put together. We've got an organ test kit, so if you're a tester, it contains 35 different tissues that you can use to test the organs in the body and then test the Nestmann remedies to see what balances things out. And then with these resources, we've also put together the Nessmann family of remedies with a new Nessmann remedy booklet that summarizes everything that we've talked about today. And with a quick reference guide. So if you've got a patient with cystitis, then you can see, oh, you need to use Solidago. If you've got a patient with hemorrhoids, then Aeschylus would be the remedy to consider. And so with that, I really appreciate everybody for joining the webinar tonight. And thanks for learning with me and learning more about Nessman. Thank you to all of our wonderful practitioners who shared their clinical pearls and their testimonials to be able to enhance the presentation tonight and to add that voice to the biomed family and the biomed community on how things are being used and the success that's happening in their practices. And so I thank you very much and have a wonderful evening.